So much for that update, Ariana. And as lawmakers debate raising the debt ceiling, hard-hit Americans are facing growing inflation. And come Sunday, millions will be faced with eviction. The federal eviction moratorium ends, and it may take an act of Congress to provide relief for renters. The expected evictions could cause a public health crisis as millions are forced out in a pandemic. Joining us now to discuss this is Alicia Coulter, a healthcare professional with a background in advocating for Black and brown people. Thanks so much for joining us. Tell us, what are the likely health impacts of the impending eviction moratorium?
So the likely health impacts include risk of spread of COVID-19, which we are still in a pandemic. But on top of that, we have the Black community that is more at risk for other comorbidities, diabetes, not being able to access health care, not having their medication available to them if they are no longer within their home. So we run the risk of a health crisis right now.
And of course, not only is there COVID, we're getting into October almost, the end of the Friday's
Yes,
October. We're talking about
flu
flu
season.
season.
Yes.
Yeah, is there a possibility now that the healthcare system could be overwhelmed, in particular hospitals overwhelmed because of flu cases and COVID cases?
Absolutely. And we're calling it a pandemic on top of a pandemic possibility. And so with flu season, hospitals are already overwhelmed. And we saw last year what the winter surge looked like for COVID. And although we're hoping not to see those same numbers, we do have the risk of flu season because individuals are out more. We have the risk of flu season being more of a risk. And so if individuals do not have housing, they're more at risk of getting sick from flu and then having to go to a healthcare system that is already heavily burdened.
So if you are immunocompromised, which many people are, they have other health issues and they're
Mhm.
facing eviction, is there anything they can do to protect themselves?
So yes, first of all, if they have access to a physician, which that in and of itself is a difficulty for the Black community having adequate health insurance and health coverage. If they do not have access to a physician, they must go to their nearest urgent care or emergency room. Unfortunately, with the lack of access to healthcare providers, because some healthcare providers have a backup of 1 to 2 months before they can see their clients or their patients. And so there's challenges with that. So if you're unable to do that, then the best option for you would be to go to the hospital immediately. Do not concern yourself with hospital surges. That is not the concern of the layman or individuals that do not work in healthcare. Let the hospitals worry about that. Do not put your health at risk by not seeking immediate help.
I want to also talk about the debt ceiling, the debate that's happening right now on Capitol Hill. There's a possibility that Medicare payments could be paused if the government shuts down. I want you to talk about how that would affect Black and brown Americans in particular.
Well, being that Medicare is managed by the Center for Medicare and Medicaid Services, that's not just a concern for Medicare. It's a concern for individuals that use Medicaid. And both of those safety nets are generally used by individuals that are low income if they're not over the age of 65. So the risk that they have is there are already practitioners that will not see them because of the type of insurance that they hold. But there are also practitioners that may not see them because their insurance will not pay them. So again, we are sending people back to the emergency room for diagnoses that can be managed at the healthcare provider level within the office of the healthcare provider. And so yet we're running the risk of overburdening our healthcare system. But I want to stress to the Black community, please do not allow that to keep you from going to seek help because we're not to concern ourselves with the hospital system that is overburdened. That is our government's concern to make sure that the insurance payments are made so that providers will see their patients.
But if you go to the hospital and you can't rely on Medicare, you don't want to be responsible for paying for this.
So what happens is those bills are then backdated, right? So the bills are then once the government comes to their budget and they confirm and they vote on it and move forward with that, those bills will then be covered. So individuals should not have to concern themselves with that. They should contact their insurance company if their Medicare is covered by ARP, Anthem Blue Cross, whichever system they choose to use. They should contact them and ask them what type of emergency measures have they put in place just in case Medicare bills are not going to be covered.
Yeah, good advice. Start preparing now and getting some answers from the people who can help. Thank you so much. We appreciate you joining us. That's excellent advice. Take care. And when BNC returns, a battle over border policies has a sitting governor filing suit against a sitting president. What's at issue? After the break. Stay with us. This is BNC.
Closed captioning brought to you by Nutrisystem. Lose weight and get healthy with meals delivered to your door.
Introducing Hearty Inspirations from Nutrisystem with up to 30 grams of protein so you feel full as you lose weight. Call or go online to get Hearty